And with us is Dr. Tristan Richardson, Medical Director of Medical Care Group at University Hospitals, Dorset. Morning, Dr. Tristan.
Morning.
Thank you for joining us. So hearing Councillor Wolf there say it's much worse this winter, do you echo that? Is that what you're finding at your hospitals?
Absolutely, it is. It's been getting worse year on year, to be fair, but the additional aspects of staff sickness and COVID have made it even worse. So currently, I think 190 medically ready patients in Bournemouth and Poole hospitals as of Friday.
Right. So there is a drive to free up beds this week. There is a big push. What can you do? How are you pushing that drive?
So there's things that we can do in the hospital. We're not perfect, and we need to get the right paperwork and the right assessments done, and that's difficult with the staffing levels that we've got. We've probably got up to 10% of staff sickness on an already frazzled system, as he was saying. That's probably quite a good way of describing it. So the people that do the assessments are short-staffed, and the nursing staff is under pressure, as are the doctors. So there's the staffing issues that are there as well. And then we've got to try and tackle the external side of things. And that's where we are working quite hard around getting care hotel beds. So that's looking at hiring a whole floor in the Village Hotel opposite Bournemouth Hospital for patients to stay in that don't need to be in hospital. We're looking at getting overseas domiciliary care staff from Europe. So another sort of not rapid win, but something that could happen that make a difference. And there's governmental funding for personal health budgets for families. And I think that's really important. So when you look at patients that who've come into hospital and they need, let's say, three people to go in 3 times a week, 3 times a day to help them with their washing and care. If we can make that twice a day and get the families to look after the third episode of care, then we'll be able to get people home quicker. So we're asking families to take on some of that responsibility for their loved ones to get them out of hospital, because the longer each week patients stay in, that's a 10% further loss in muscle mass.
And what are those families saying to you? I mean, there's been talks of incentives for families, is that right?
So there is central money coming to families for personal health budgets. That was only announced last week, so I haven't got much more detail on that. But it's really difficult, isn't it? Because you and I, we're working during the day, and it's really difficult in the culture that we've got. We've got a very work culture, and that's not right or wrong. It's just where we are. Mm-hmm. But we can't look after our loved ones during the day. So that's why I'm saying that, is there something that we can do for the evening sort of package of care, if you like, the washing and caring to put our loved ones to bed whilst we get the packages of care set up?
Yeah. How is that conversation going down then with families?
It's variable, because it's really difficult, isn't it? If I were to say to you, well, actually, you've got to look after your loved one, and you say, well, actually, I'm working. And how does that work out? It's really difficult, because there's a balance to be had.
Yeah. So with all these different ideas you've just mentioned, do you see an improvement with the drive this week? Do you see an improvement, or is it kind of likely to get worse before it gets better?
I think the difficulty is that we've got 140 care homes which are closed to patients at this moment in time. So that's an immense amount of care beds that we can't use because of staffing, because of COVID. So we're really working with one arm tied behind our back. So I'd love to say it'll get better, and we are working hard to try and make it happen. But it's massively frustrating for hospital staff, and it's massively frustrating for our poor patients, because that's what our number one focus is around our patients. That's what we want, to get their care as good as possible. Patients don't want to be in hospital, and we don't want them to be in hospital when they don't need our help. And that's also stopping the other patients needing our help obviously getting that.
So declaring a critical incident last week, what was the crux of that? What was the reason behind that?
That was exactly what I'm saying. There are ambulances waiting outside our hospitals. We can't get patients into our emergency departments, and that's because those emergency departments are full, because we can't get the patients that need to be in hospital in the beds in the hospital, because we can't get people out. So it's a logjam all the way through the system that shows itself at the front door.
Have you got any words to people who are listening to this to reassure them of the situation at their hospitals?
Well, I'm immensely proud of the staff. We are working massively hard to give the best care in difficult circumstances. Our staff are absolutely frazzled and tired, having worked with COVID for the last 2 years nearly. But we are working our best to deliver the very best possible care. But what we've got to do is try and focus that on the people that need our help most.
Talking about that, looking after yourself, that personal care, how do you balance, you personally and the people that you talk to, how do you balance your lifestyle with what's going on at the moment?
Well, if you ask my wife, not very well. It's about support from colleagues and families and loved ones. And it's difficult because there's no end to it. So we're all working extra weekends, and everyone works hard. So I'm not wanting people to feel sorry for us. That's not the position. But we are working out to do an extra shift on Saturday because that's what's needed. So people are pulling out all the stops to do their best for patients, because that's what we're here for at the end of the day.
Well, thank you for that, and thank you for talking to us this morning. Dr. Tristan Richardson, Medical Director of Medical Care Group at University Hospitals Dorset.
Thank you, Emily. Listening to that is Dr. Tristan Richardson, Medical Director of Medical Care Group at the University Hospitals Dorset. Tristan, good morning.
Morning.
Is it possible for you to move people at that speed who have been stuck in hospital and need to get out into the community or other care?
Absolutely. The bed blocker term is not a nice one for patients. These are all individuals and we want to do the best for them, of course. And we know that when they're stuck in hospital, they're losing 10% of their muscle mass every week. So there is an essence of
I think we've just lost the signal there for Dr. Tristan Richardson. So we're just going to see whether we can reconnect momentarily, because those numbers are really intriguing, aren't they? That's 200 people are stuck in East Dorset hospitals every day who don't need to be there. But whether they can be moved to somewhere more suitable, whether the capacity is there, I'm intrigued to know whether Dr. Tristan Richardson thinks that it's a bit of a headline grab rather than something that's actually practically possible. Tristan, sorry, we lost you momentarily there, and you were talking to us about whether it's possible to move people out of hospital into other care.
Yeah, we've got people absolutely waiting at this moment in time, ready to go. So there is the opportunity for rapid movement of patients out, and we need to do it quickly because patients lose their muscle mass with every day that they're in hospital. So it's really important that we don't decondition patients by keeping them longer than they have to, but that they are ready to, lots of patients ready to go at this moment in time.
Where's the problem then with regards to why haven't we moved these patients?
It's a problem across the system in the same way that potentially up to 10% of our staff in the hospitals are sick at this moment with COVID and other reasons. The social care system is also dealing with a lot of staff sickness. So we've got to look at alternative solutions. We're looking at care hotel beds, getting domiciliary staff from Europe, looking at buying any capacity we have, but staffing is still a major issue. There was a government movement from last week around paying families a public health budget. So there are things that are coming out rapidly, hopefully, to try and get movement going for this fragile population.
You had to declare a critical incident last week. Was that about lack of beds and staff?
Yeah, critical incidences depend on a number of things, but that was absolutely, we had patients waiting far too long in our emergency department, trouble getting into beds in the hospital, and that's because we can't get people out of hospital. So if you think that every person that's stuck in a bed in hospital means that we can't get a surgical patient in for their cancer therapy. So it's really massively important.
You've got enormous amounts of experience here, Dr. Richardson. I'm just wondering, although the government is whipping up a bit of a storm to say people have to be moved out of hospital, what is the real issue? That there just aren't enough additional care beds in the system, that we haven't got the structure right, we're not paying staff in the care sector enough? You must have seen this time and time again.
I think it's There's a number of issues. We have got 140 care homes which are closed to repatriation of patients across Bournemouth Council as well as Dorset. So 140 care homes, that's a huge number of previous accessible places for our patients that are now we can't get patients there. So that's because of COVID, that's because of staffing, but it's a massive issue. 190 medically fit patients at this moment in time. Waiting, 80 of those are waiting care home beds. And yes, we've got to make it more attractive, haven't we? Government, there's been a lot of lack of funding for social care over the years. And I think also culturally in the UK, there's often sons and daughters are working, understandably. It's not right or wrong that we're all working as well. So in other countries, we look after our elderly, and that's just not a right or wrong thing. It's just the state of where we are.
Fascinating bit of insight. Dr. Tristan Richardson, thank you for your time this morning, Medical Director of Medical Care Group at University Hospitals Dorset. Your take on that, always welcome to let me know. I've got a free phone number if you'd like to throw your opinion at